Well, I'm delighted now to be joined by CEO and President of the Global Health Council, Jeff Sturchio. Jeff, welcome. Thank you very much for joining us today. Now, Jeff, why did you pick this year's theme?
Well, this year's theme is securing a healthier future in a changing world. And we chose that theme because there's just a tremendous amount going on in global health these days against a backdrop of major changes in the economic environment, continuing changes in technology, and most importantly, we're seeing changes across the spectrum in the health challenges that countries are facing, whether they're poor countries, middle-income countries, or wealthier countries. So this conference is going to include many sessions with, we have almost 2,000 delegates from more than 50 countries from around the world, looking at different aspects of what we need to do to ensure that people will be able to live healthier and longer lives in the years ahead.
Now, Jeff, I know you also have a focus on non-communicable diseases this year. Why is that?
Well, that's one of the biggest challenges that the world's facing, and actually this year is a particularly important year for looking at non-communicable diseases. There will be a UN high-level meeting in September at which member states of the UN from around the world will get together to really look at how to meet this challenge. And what we're talking about are particularly the non-communicable diseases like heart disease, asthma and other respiratory diseases, cancers of different kinds, and diabetes. And together, those conditions cause more than 3 out of 5 deaths in the world every year. And of those, 4 of 5 deaths are in developing countries. So this really is a growing epidemic, and it's one that hasn't gotten as much attention in the last few years as epidemics of infectious disease, AIDS, TB, and malaria had.
Now, Jeff, from what I understand, middle-income countries this year are facing a particular squeeze.
Yeah, well, it's the squeeze has come because we're coming out of a global economic crisis from 2008, 2009, and so countries are facing the need, as many are in individual countries, they're facing the need to do more with less. And so one of the sets of issues that delegates at the Global Health Council conference will be looking at is how to achieve much more outcomes. That is, or another way of putting it is to say, how can you get more health for the money that's invested? So they'll be looking at ways to deal more effectively and efficiently with the health challenges they're addressing with, in many cases, more limited resources.
Jeff, global health is in the news all the time right now, isn't it? As we speak, there's the Gavi conference in London. Have you noticed a particular change this year? Well,
I think that there's a growing understanding that health is absolutely fundamental to both the economic prosperity of countries and more generally to security and stability around the world. It's not just the conference, the replenishment conference for the Global Alliance for Vaccines and Immunization, which is taking place now. But last month we had the World Health Assembly. Just last week was a high-level meeting on HIV and AIDS at the UN, which led to a political declaration that has very clear targets for what countries are going to do by 2015, as well as an unequivocal commitment to human rights in the AIDS response, which was very important. At the Gavi Replenishment Conference, they're going to be asking for on the order of $4 billion, which will save 4 million children's lives over the coming years. So that's really an important challenge. And then later in the year, as I mentioned, there will be the Non-Communicable Diseases Summit at the UN. So it's, these meetings and both the Replenishment Conference and these high-level meetings are really useful because it puts health squarely at the center of the political agenda. And in order for us to really make progress at saving millions of lives and saving millions of others from debilitating consequences of infections, whether chronic disease or infectious disease, political will is the place to start. But obviously you also need broadly based partnerships of both governments and civil society, including the private sector. And also we're going to need the financial resources that are commensurate to the task. So it's a big agenda, and that's really why so many people are here this week in Washington to focus on solutions.
Now, Jeff, here's a tough question for you. What are you most looking forward to this week?
What's always most interesting is the exchange of views from people from the field, who are actually out there, sleeves rolled up every day, dealing with the issues, whether it's children who aren't getting the treatment they need for diarrheal conditions or aren't getting the immunizations they need, mothers who are facing perhaps the challenge of being HIV positive and and being pregnant and dealing with those conditions, as well as the fact that there are just millions of people with undiagnosed diabetes or cardiovascular disease. And we have, the good news is we have solutions for all of those conditions. The challenge is making sure that everybody who can benefit has access to those solutions. So I think having the perspective of people here from all around the world is really, it's always one of the most exciting aspects of this conference.
Jeff, thank you very much indeed for joining us here today on Global Health TV, and I hope you have a fantastic week.
Thank you.